problem. Okay. So she's reported her symptoms are reduced, and she doesn't have any complaints regarding me or anything, so that's great. So we're going to get you lying on your stomach, please.
Sure.
Face down. Everything's all wiped down here. I'm just going to evaluate her lumbar spine. Scoot down a little bit. So it's a little bit sore in the L1-2 region that in the workup, the initial workup. So I'm going to get her to communicate to me about her tenderness. So initially, I didn't use this device. I just wanted to see how sore she was, or if she was sore at all through this region. And after identifying that it was the upper lumbar, then I brought this out. And you can just hold this device there and just squeeze it when you feel any soreness.
Perfect.
Yeah. Put down at L5. Okay. So I noticed, so when I pushed down L5, the meter came up a little bit, but when I come back up to L1-2 here, it's kind of the apex of the tenderness. I'm suspicious that maybe a little bit of irritation down the bottom here too, so maybe 2 sites. But nonetheless, she's not complaining of back pain, so I don't make a big deal about it at all, because she's young and resilient, and she's got a wonderful athletic start. She was a dancer, correct?
Yeah.
Yeah. All right, so good. So as I'm applying force, I'm distracting and holding on to L1, and I'm trying to stay below the threshold that she's given me. So this meter is coming up to about a 22, 24. I like to stay in those lower ranges. Right? And as I go along here, I'm using a little bit more force because I can see the meter is actually dropping. She's not indicating the same measure of soreness. So it tells me we're doing something here to improve the tissues. So now I'm using even a little bit more force, and to give her more of a therapeutic dose of flexion distraction. And the meter's not coming up to, so initially it was a little bit more sensitive and tender. See, L5-1 is a little bit tender here, I see. So I'm going to work on that too. So I pictured her history of dancing, and she did it for many years. Is that correct?
Mm-hmm.
Yeah. Modern, contemporary, you did it all, didn't you?
Yeah.
Ballet was a big one, right?
Points, all that.
Right, so because I've got a daughter in dance, I have a pretty good idea of what those years looked like for her.
Mm-hmm.
So, and with dance, as long as it looks good on stage, who cares what it's doing to the spine, right?
Pretty much.
Yeah. So she's doing really well through here, so. So it was her cervical spine that I was more, not concerned, but more attentive to. The lumbar spine, I don't think you didn't report too much soreness after the car accident in your lumbar spine, right?
No.
So I don't know what that normal was before. So let's get you to lie on your back, please.
Sure.
See, she might have had some tenderness there before, and it just went unnoticed, and it's not a big deal because a lot of people do have soreness down there, especially with a history like she has. So we can hold that there. So last time I identified that it was the upper cervical spine that was a bit more sensitive. So start at C7, C6. Let's do, okay, that's about a 48. All right, a little bit more sensitive around C4, C3, C2, C1. So I'm seeing that the lower cervical spine here is a little bit more tender, I think, here. So, okay, well, it's cooled down a little bit now. So it changes dynamically as I investigate the tissues. And I'm applying a little bit of force here and traction just to create some separation. And I know I'm making her work. She just wanted, I think last time she just wanted to relax and take it all in, but I apologize. I made her work. She says it takes a bit of, you got to think about it, right?
Mm-hmm.
Yeah, so she feels like she has to really kind of play an active role. There we go. So you see, if I get into the extension dynamics, tenderness comes down a little bit. I know when I did her active range of motion assessment, her extension was like superb. And so it gave me some clues on what I may want to do from a therapeutic standpoint. Yeah. So as I course along, the sensitivity is coming down now, so it tells me that likely I'm doing something positive for her. If the levels start ramping up when you are doing your thing, then you probably want to pay close attention and change your approach. Because if the levels start to decrease, you know that you're not bugging anything in there. Alright, so lateral flexion is just, zero sensitivity, so she's got wonderful lateral flexion. And I'm thinking of the uncovertebral joints, right? When I go to the sides here, so likely those guys are happy. Tells me a little bit about disc height. So now the sensitivities come right down. So then I start to apply a little bit more force because I can, without inducing any extra soreness. Yeah. But this is a wonderful way to let the patient know that they are being heard, listened to. And it's shaped like a paddle, so if she really dislikes what I do, she can just bonk me over the head. So I'm not liable if your patients hit you over the head, just so you know. That's not what the intent is of this thing, so. Shut this off. So there you go, there's an example.